Good morning, everyone. Nice to see you. Welcome to Washington if you're from out of town. We got the nice warm weather for you. I'm very honored to join this gathering and to join you in this discussion of health literacy. I appreciate your work, and this is an incredibly important topic. And in terms of the broad lessons of implementation so far, I see health literacy challenges arising in three broad areas. One is eligibility, just navigating the system of coverage and figuring out where people belong, what they're eligible for coverage, and how to sign up for it. The second is choice of plans. Often people are now offered a choice, often a broad choice of plans, and they need to distinguish differences in features of health insurance coverage, and that can be a challenge. And then finally, using coverage once people get enrolled, how do they use their coverage to actually connect to the care that they need? Now, how do I advance this? Is there, that. Okay, so we're in the third year of implementation now. We've made impressive progress. Coverage has been extended to about 20 million uninsured individuals. Private markets have been changed, new rules applied, new subsidies applied, and this is all impressive work. I'm actually going to start with this slide. It's not really a Kaiser Family Foundation slide. This was made by my good friend Linda Blumberg at the Urban Institute, who wrote a tremendous report called Who Are the Remaining Uninsured and What Do Their Characteristics Tell Us About How to Reach Them? So that should definitely be in your required reading if you haven't already committed it to memory. And just briefly, Linda has looked at the almost 3 million remaining uninsured to see what we know about them and what they may be eligible for. And many of them are eligible still for coverage, so we need to help them navigate that system of finding their source of coverage. It's the blue areas of the chart that represent people who are eligible, about 9 million eligible for Medicaid or CHIP, and about 7 million, just under, eligible for premium tax credits to subsidize private coverage through the marketplace. The yellow areas, over 5 million immigrants in undocumented status, nearly 4 million people in the coverage gap, people below the poverty level who live in states that haven't expanded Medicaid. And then I messed with your slide and made that last section kind of both blue and yellow. People who, that's a mix of people, some have incomes over 400% of poverty, so they're not eligible for credits. Others are eligible, we think, for employer-sponsored coverage, which would make them ineligible for tax credits, but that hasn't been implemented all that clearly, and there are a lot of questions and a lot of documentation problems in determining that, so that just adds to the complexity of navigating. So that's just all really by way of showing you that this is a complex system and people need help sorting out their eligibility. That's the first challenge. And people are not informed. Our tracking polling, which we've done monthly since the Affordable Care Act was enacted, shows that public awareness about the details of the Affordable Care Act remains pretty low. And each year, toward the end of open enrollment, we have also polled uninsured individuals to ask them if they knew that it was open enrollment time, if they knew that the open enrollment deadline was about to end, and if anyone had reached out to them to help them sign up for coverage. And mostly people are still not aware of the rules and of the timing. So to me, this is a prescription for in-person assistance. It's important that there be more information, that we get it out there, that we get it out in understandable language. But this is really complicated, and people need to sit down with an expert and kind of hold their hand and walk through this process. The Affordable Care Act does establish a new infrastructure for consumer assistance, which is important. Two main types of new consumer assistance resources are provided for under the Affordable Care Act. One is enrollment assistance based in the marketplace. We poll these marketplace assisters every year now. So just finished our third survey. There are over 5,000 assistance programs, marketplace assistance programs in the United States, employing about 30,000 professional consumer enrollment assisters. And they are They are working hard. This is time-intensive work. It takes on average 90 minutes, even after 3 years, to walk people through the process of figuring out what they're eligible for and looking at their plan choices. Many of the programs are not sufficiently funded. They are many of them are uncertain as to what their funding will be in the coming year. And to add insult to injury, the marketplace was created to simplify this whole process for consumers, to be the single point of entry. If you're uninsured and you need help and you need to figure out what you're eligible for, you go to the marketplace and find out. But many of the marketplace assisters don't get paid or don't get credited when they help someone sign up for Medicaid instead of a marketplace plan. So that's an additional challenge. These assisters, I think there needs to be more investment in-person marketplace assisters. In addition to funding support, I think better technical assistance, improved call centers, and as you work on strategies and think about approaches to making this all more understandable for consumers, I think it's important to be in touch with the marketplace assisters and find out what they understand the literacy shortfalls to be, and also design tools and resources that will help them do their jobs more effectively. In addition, we've got statewide consumer assistance programs not based in the marketplace, but to help everyone in and out of the marketplace enroll in coverage, and then understand and use their coverage effectively and resolve problems with their coverage once they're enrolled. These are also programs that are underfunded, and I'm going to come back to them in a minute. In terms of enrollment through the marketplace, this slide is sort of telling you a bunch of things at once. The dark blue lines indicate the number of million people enrolled in marketplace plans at the end of each of our open enrollments, 1, 2, and 3, and then the number of people who could be, we estimate, enrolled in marketplace plans with tax credits if all states were enrolling at the rate of the 10 states that have the highest enrollment rate. So people enroll at different rates in different states for lots of reasons, including whether or not Medicaid has been expanded. But when you sort of rank the states, and you can see this on our website under State Health Facts, you see that the top 10 states, top 10 enrolled states, have enrolled close to 60% of the people who we estimate are eligible for tax credits in marketplace plans. And the bottom 10 states are down closer to 30%. So and there's a range in between. So if all states could get up to that higher rate, this just sort of underscores, I think, Linda's point that there are people who are eligible and we could get them enrolled. And again, lots of reasons why, but I think consulting with the assisters in these successful states and their strategies and how they're doing that is an important thing to do. The light blue bars show what enrollment is at the end of the year. So every year now, enrollment has peaked during open enrollment, and then we see attrition during the year. That's a natural thing in the non-group market. It's a residual market. People only go there when they aren't eligible for other coverage. So as they get jobs and move and marry and stuff, we should be seeing some people cycling back out of this market, but we should also be seeing people cycle in during the year. Estimates are that almost as many people should be enrolling or are eligible to enroll during the year because they have qualifying life events as enrolled during the open enrollment period. And that we're not seeing. Last year there were about 1.5 million people who signed up for special enrollment periods. So I think that adds to the literacy challenge. In addition, not only do we need to help people understand what they're eligible for, we need to let them understand it when they're eligible, because it's narrow windows of time. Okay, so what about then helping people choose their health plans? No surprise. We've pulled this, you've studied this. This has been well documented. People don't understand health insurance. I have trouble with it. I think we all do with some of the harder stuff. A couple of years ago, we administered a very simple quiz through our polling team to a random sample of adults and just asked them some very simple questions about health insurance, about basic health insurance terms and what they mean. And then we gave them two, I thought, pretty simple math problems where we gave them a very kind of straightforward coverage rule and cost-sharing rules and asked them to calculate what the patient's out-of-pocket costs would be. So only about half of the people that we polled got at least 7 out of 10 correct, and most of them got a lot less. They did pretty well on the basic terms, not well at all on the math problems. People just couldn't figure out kind of how to apply a deductible and co-insurance, and didn't really understand allowed charges and billed charges. So we saw pretty low scores on that. The challenge, let me go back. The challenge of understanding health insurance is critical to picking a plan, right? Because there are so many plan choices. On average, in federal marketplace states, participants have a choice of about 50 plans this year, and oftentimes the differences are pretty, many, and pretty nuanced. So I think policymakers in some states and at CMS are looking into more standardized plan options, just so there would be less for people to master and compare. And I know there's going to be discussion today about other kinds of plan compare tools and plan understanding tools, but I just wanted to commend for your consideration the summary of benefits and coverage. Are people familiar with the summary of benefits and coverage? I know Elizabeth is. Okay. Every plan has one of these. Grandfathered plans, non-grandfathered plans, marketplace plans, they all have to create this. This is a requirement under the Affordable Care Act that all plans have to provide a standardized summary of covered benefits and the cost sharing that applies. They all look like that, blue and white. They all have the same chart format. They're not that pretty, but they all have the same information. The first page kind of goes through what are the major kind of cost-sharing things. There's supposed to be a link to the network. And then on subsequent pages, they go through each of the essential health benefits, and they explain to, in plain words, why you might need this benefit, and then how it's covered. And it just goes through like this, all right? So it's out there. It's a tool. It's not perfect yet. Improvements to it are moving slowly, but to the extent that you're helping people, I think, learn about health insurance, these are key pieces of information that are available about every plan. The SBCs now they're on the Marketplace website for all of the Marketplace plans. Usually you have to click 3 or 4 times before you get to it. It's not interactive. When we built the original healthcare.gov, when I worked at CSIO at the very beginning, we tried to create the plan display based on what we thought the SBC was going to look like, and we even created sort features so that you could sort based on how maternity care is covered or what the emergency room deductible is or so forth. So anyway, as you talk about sort of developing these tools, I hope you'll take a look at the SBC and the structure of information that it provides and see if there's a way to build that in to your lessons for consumers. I just want to mention quickly, the ACA provides for another kind of transparency tool that hasn't been implemented yet. But this is just a requirement on health plans to report data on how they work in practice. So how stable is their enrollment? Who comes, who leaves every month? How do they pay claims? How often do they pay claims late or deny claims? How broad is their network? How often do people go out of network, and what do they spend when they go out? So these are kind of performance measures that I think would also be useful for consumers as they're evaluating their plan choices, not just what's covered under the rules, but how well does it work? How much do I get hassled? So that's kind of still on deck, but hopefully will be implemented soon. And then just very quickly, I think the last literacy challenge comes when consumers are enrolled and then they have to figure out how to use their coverage. If the transparency data ever get implemented under the ACA, then I think we'll know a lot more about that as well. But meanwhile, our polling data sheds a little bit of light. We have an uninsured survey in California where we've been tracking people over time. And that survey tells us that the uninsured are finding a regular source of care much more often than they did. The newly insured are than when they were uninsured. This slide is from our non-group health insurance survey, which is also, we just finished wave 3 this year. We are seeing a decline in consumer satisfaction, enrollee satisfaction with their health plans. A majority this year, 52%, rate the value of their non-group plan as fair or poor. Last year it was 42%, and the year before it was 39%. And the reason seems to be high deductibles. So whether people realize that when they sign up, they're learning about high deductibles once they get their plan and try to use it, and they're having difficulty with this. Interestingly, when we surveyed the navigators and the marketplace assisters this year, we asked them, if you could change one thing in the ACA to make it work better for people, what would you do? Subsidies or better information or whatever. Lower the deductibles. That was their number one choice by 2 to 1. So the high deductible plans make it harder for people to get to the care they need. One other thing about kind of using health insurance and teaching people, I think we have to recognize that some people get a health insurance card and they just leave it in their wallet and they never use it again. They don't go to the doctor, they're healthy, they don't need a lot of care. At the other end of the extreme, we've got people who are going at least once a month. So I think, that educating consumers about how to use health insurance has to recognize sort of where they are in their own health care needs and structure the lessons toward that. Among the high utilizers in our survey this year, we did ask them, are you having trouble with your plans? And a majority said yes, they were. So in a range of troubles, the plan didn't pay as much as they expected it would for a covered service, or it didn't pay anything, or they couldn't find a doctor in network, and so forth. So once people are using their coverage a lot, they're much more likely to encounter problems. Those problems may arise because the consumer didn't really understand how to use their coverage and they didn't do it right, and they could arise because the insurance company didn't cover it right. They make mistakes too. So back to the caps, which I promised I would come back to, Elizabeth. This is why it's very important for there to be in-person assistance available for people when they're in their plans. If they're high utilizers and they're encountering these problems and they don't know how to use their health insurance, P.S., they're also sick. So they're going to need some help at that point, not just, a piece of the Federal Register to read. So I think the in-person assistance is important. And another important thing about the caps is they are required by law, when they're funded and operating, to report data back to the Secretary on what are the problems that consumers encounter. And the Secretary is supposed to make that public and incorporate that into oversight. So I think understanding what's going on with consumers, seeing the problems, correcting them when it's a pattern problem on the part of the insurer, but also then giving us all insights into how to make this simpler and more intuitive for consumers is important. Just the last thing on this non-group market Wave 3 survey, we also just asked people if they knew that preventive services are supposed to be covered 100%. And a lot of people didn't know that. They were more likely to get it wrong if they were enrolled in high deductible plans. But at any rate, I think we have many challenges still arising in helping people use their coverage effectively, and I think we all, in addressing this, need to go back to the professionals who are working one-on-one with consumers and make sure that we've captured all of their expertise as we move forward. So I'm going to stop with that. I do think your agenda is very important, and I think one other lesson just in general is that our system is complicated kind of from the beginning to the end. And so as you are working on this, any insights that you can convey to policymakers about ways to make the system a little bit simpler to access or to select plans or to use plans will probably also be an important public service. Thanks very much.